Sickle cell is something which unfortunately lagged behind again. We had lovely 3 drugs or 2 approved drugs, so to say. The third drug was not approved in the UK. 2 drugs which were approved but then withdrawn, unfortunately. And at the moment, of course, we have got the gene therapy. The gene therapy is very expensive, and it is again happening in very concentrated centres, which I totally agree and fine with that. But I think what we might need to do that we need to make it more accessible, and we need to fast track these patients. I have got so many patients in our centre who are suffering in a big way from sickle cell anemia, and gene therapy should be made accessible to these patients much quicker. And you might have relaxed the qualifying criteria for these patients because as you can imagine, that these patients' quality of life is quite poor, and of course their organ damage will happen more and more as they actually wait longer for the gene therapy. So that is my anticipation and expectation again in this area. We are making fantastic progress in other rare diseases like hemophilia and thalassemias, but sickle cell anemia, we are the 2nd largest centre in the country, and gene therapy needs to come thick and fast to these patients so that they can be benefited with the new advance in science. This is the most happening time for hematology last 10 years, and we have seen massive progress, and that is good for science, that is good for patients.